Hi, I'm Sam Hawley, coming to you from the lands of the Gadigal people. This is ABC News Daily. This week, doctors were left furious after claims suspected fraud, misuse and billing errors are costing Medicare billions of dollars a year. The Australian Medical Association says it's an unjustified slur, with the vast majority of doctors sticking to the rules. Today, the journalist behind the report, Adele Ferguson, on her investigation and why the profession needs to be held accountable. Adele, I want to get a real sense from you about your investigation, how you found out that Medicare is allegedly being rorted of billions of dollars. Give me a sense of the type of fraud that you uncovered.
How this came about was originally I'd been working in the cosmetic surgery industry space with the Cosmetic Cowboys, and one of the whistleblowers, Justin Nixon, had said, there's rampant Medicare fraud going on here. And that led me to Dr. Margaret Foe, who had done her PhD into Medicare and ran a business that actually gets paid to bill doctors, hospitals and corporate clinics. So she had a real insight into the extent of it. So this is the PhD.
Yes, and it took me 8 years.
So what are we seeing here?
So this is our billing software, which is...
So what did you find out about Medicare and what was going on?
Well, she found that, claims and compliance, that it's up to 30% that are problematic.
So you can see how little information you need. You just need first name, last name, date of birth. You need a Medicare card, but if you can't get it, it's quite easy to get Medicare numbers if you're authorised. And these are bulk bill claims. They're all going to Medicare. They've all been successful. So what that means is the money will be in the bank account of the doctor overnight, no questions asked.
As easy as that?
Oh, yeah.
It's not just fraud, it's errors, it's over-servicing, and then there's the fraud such as, doctors billing dead patients to get the Medicare rebate.
Dead people. Are you serious? How low can you go?
There are 5,800 different Medicare codes for different services, and so sometimes doctors will key in the wrong code. Sometimes it can be just over-servicing, so you have under a few minute consultation, but you'll bill for something that's much longer. Or it can be get people to come back, so the packing and stacking.
Okay, you mentioned earlier GPs even billing dead people. What else have we seen in this area?
We have seen things like doctors billing dead people in aged care homes. There were doctors who were actually treating drug addicts by giving them oxycodone pills and having to repay hundreds of thousands of dollars. So really the drug addict patients knew when there was a soft touch GP that they could go there and get the oxycodone prescriptions and pay, they would then bulk bill the Medicare card. And the problem with that is if you're a drug addict, the GP should be trying to treat you to get you off them, not to be giving you more drugs. We had practitioners who were telling patients that they had diabetes when they didn't have diabetes so that they could claim more. So there's a lot of egregious examples that, we can just go on and on and on of the different things that have that have been seen.
You have one new message.
Hi Adele, it's Austin here. I've got all the emails, the CCTV and the...
You also interviewed Austin Stern, a GP turned whistleblower.
So he helped set up a super clinic in 2013 and he was there for a couple of years, and in 2015 he started to notice there were some anomalies. There was a patient who had allegedly come in the morning and then in the afternoon, which seemed, a bit excessive. So he looked into it. Patients said no, they'd only come in that morning. So then he started to look at other patients, and then he started to marry it with CCTV footage and the appointment books, and he found that there was, something systemic going on at that clinic.
What sort of things did you find?
There was falsifying of patient records, there was billing Medicare for services that hadn't been provided, and there was over-servicing going on as well. This is the rainforest waiting room, so you could see what time they came in and what time they left the room, and on the date that it was done.
And you'd marry that up?
Yeah, so we married it up with the appointment book, and then the billings didn't reflect the people who were going in there, and the billings didn't reflect how long patients were spending in that room either.
But this is pretty damning. It's completely empty.
Yes.
And one of the practitioners would be in the back of the room, he was saying, just writing out Medicare when there was nobody there. And he confronted he told the board what was going on, and he said he was just getting a lot of pushback. And then the more he dug, the more he found.
And he ended up taking action against the clinic, didn't he?
He did. So they, after a while, they got sick of him going on about Medicare, so they tried to get rid of him. So he ended up getting an injunction to stop them, and then they ended up with a settlement, really, and he left at the end of December 2017.
So, Adele, Margaret estimates $8 billion was lost from Medicare.
So $8 billion comprises both fraud and errors.
Which is actually staggering figure. How did she come up with that figure?
Yeah, so she's saying up to $8 billion, which is an estimated 30% of the overall Medicare pool of money that we have each year, and that goes up every year. And she's not just calling it fraud, she's saying that it's errors, it's waste, it's over-servicing.
The bottom line is we don't know exactly how much is fraud, deliberate abuse, and how much is errors. But in the end, it actually doesn't matter anymore. Whether it's deliberate or unintentional, it has to stop.
And she based that on, she spent 8 years doing this PhD and was also standing on the shoulders of a PhD that was done in 2004 by a woman called Catherine Flynn, who had put in her PhD, it was probably up to 25% of Medicare that was problematic.
Has anyone else verified this figure? It's a very big allegation.
With a PhD, it has to be independently reviewed. So her thesis had 6 independent peer reviews looking at it and gave it the tick. And even the Auditor General in 2020 had a look and came up with a figure of up to $2.2 billion in leakage from Medicare. There was also the former head of the Medicare regulator, Dr. Tony Weber, in 2012 had said he estimated it was about $3 billion back then, which was probably about 15% at the time. Dr. Margaret Foe estimates there's about $8 billion a year in leakage now.
And that I would not be surprised at that. I've read her PhD, and I'd have to say I agree with what she said.
So they're really big figures. It's billions and billions of dollars.
Yeah, it's a huge, absolutely huge, staggering amount. The AMA, of course, has spoken out against this. I mean, it says the figure's just not right.
The story has angered AMA President Steve Robson, who says it's an unjustified slur.
I think they're not only an unjustified slur, they're just plain wrong. They just don't stack up at all. I'm actually part of the group who sits in meetings with the health department. We analyse billing very, very carefully. Anything that looks odd at all is subject to further analysis. So it's just a fantasy.
So what's your response to the AMA and what it's now saying against these claims?
What else are they going to say? They're a very powerful lobby group. It's vested interest. I think what they really need to do is take a look at it. No industry is above reproach. The Federal Minister for Health, Mark Butler, wants to have his department review what's going on and also really have a look at her PhD.
It's way out of whack with any other figure that's ever been provided to government, including, as I said, by the National Audit Office that only did a review of the program a couple of years ago. But I'm taking it seriously.
So there's clearly an issue that needs to be addressed. And we can get into the semantics of, the percentages, but at the end of the day, there is a problem with this system and it needs to be reviewed.
The claim is there's billions, $8 billion being wasted through Medicare. And it's a revelation, Adele, isn't it, that comes at a difficult time because there are fewer GPs now seemingly bulk billing people. It's a tough time for Australians in terms of the cost of living. And so really that money could be helping a lot of people.
Yes, that's right. Yes, and it's not just GPs. There's hundreds of thousands of practitioners who have access to some of this Medicare billing. It can be allied health, pathology, radiology, cosmetic surgeons. The list goes on. And you're absolutely right. GPs are upset because, and rightly so, they haven't had an increase in the bulk billing fee for years. And it's a very minuscule amount. It's not enough. If everybody was doing the right thing and the government fixed the system, there would be enough to increase the rebate for GPs and bulk billing.
You mentioned the government's going to have a look at this. Mark Butler has said that he'll look at the PhD. For instance, Jim Chalmers says that the government does need to get to the bottom of it. But in the meantime, how do we ensure, Adele, the integrity of the Medicare system?
It's really up to the Medicare practitioners. They really need to be making sure they're not over-servicing. The former Chief Medical Officer for Australia, Nick Coatsworth, is saying in an editorial that, this is a conversation that the industry really needs to have because there is a lot of wastage going on, there is over-servicing, there's a lot of low-level servicing happening, and it's billions of dollars, and it needs to change so that Medicare can survive.
Adele Ferguson is a journalist with The Age and Sydney Morning Herald. She produced her report in conjunction with 7:30. A spokesman for the Tweed Health Clinic says the management has now changed and the clinic takes compliance extremely seriously and conducts regular training for doctors. The AMA says doctors are threatening to quit in the wake of the appalling allegations. It says it does not tolerate fraud and examples should be stamped out. This episode was produced by Flint Duxfield and Chris Dengate, who also did the mix. Our supervising producer this week is Sydney Peed. Over the weekend, catch ABC Sport Daily with Pat Stack. You'll find that in the ABC News Daily feed. I'm Sam Hawley. ABC News Daily will be back again on Monday. Thanks for listening.
Subscribe to listen to more free podcasts or download the ABC Listen app and stream ad-free.